Hey, good morning. This is David with Cross Human Performance. Listen, today we're going to talk about heat therapy, thermotherapy, and versus cryotherapy or cold therapy, ice and heat, right? I've been getting a lot of questions on when should I use heat, when should I use ice, this, that, and the other thing. Can they be used in conjunction? All that. So we're going to address all that today. Okay, let's first talk about cryotherapy or ice, the use of ice. Okay, usually we want to use ice when we've had some kind of trauma, whether we've sprained an ankle, whether we've had a surgery, whether, there's been some kind of sudden trauma to the tissue or the joint area, right? Like I said, via trauma or some kind of surgery. Right? We want to use ice, all right? Because the immune response to that kind of trauma or surgery, whatever it is that you're having, is inflammation, right? So we call that acute. That would be considered acute inflammation, right? It's not long lasting, right? It will be there a few days. The ice will bring the inflammation down, so on and so forth. So again, if it's acute trauma or you've had some kind of surgery and you have some localized swelling secondary to that trauma, then ice would be more efficient, right? Okay, so when do we use heat or thermotherapy? Okay, heat is usually used for more chronic pain. Okay, when I say chronic pain, I mean more long lasting. An example of this would be arthritis, whether it's rheumatoid arthritis, osteoarthritis. Okay, this is something that doesn't necessarily go away. It's not acute, it's more chronic, right? So heat is more effective for chronic joint pain than it would be for acute joint pain or acute inflammation, right? And then people say, well, can you do both? Yeah, absolutely, right? Like if you have chronic joint pain, okay, there is some inflammation that will be associated with that surrounding the joint area. So a combination of ice and heat when we're talking about chronic pain now would be most effective. If we're just talking about acute pain or acute localized inflammation, ice is going to be the best. Okay, so just to recap, we want to use ice when we've had acute trauma, okay, whether we've fallen down, sprained an ankle, bumped into something, had a fall, or even had a surgery like a knee surgery, shoulder surgery, back surgery, whatever the case is. Ice is going to be more effective for the short term, right? That inflammation will eventually go down, that pain will go down, good to go. Now, if you're talking about more chronic pain, again, with if we're talking about arthritis, whether that be rheumatoid arthritis or osteoarthritis, right? Heat is going to be a better option because it's more chronic and will relieve pain over a longer period of time. But you also could include ice because there will be some inflammation there. Okay, so I hope that was clear. I hope you understand the difference between cryotherapy and thermotherapy and when to use heat and ice. Hope you have a good day.